2020 health plans. The health plans available for plan year 2020 are Blue Cross Blue Shield of Oklahoma, Blue Links HMO, Community Care HMO, Global Health HMO, Health Choice High and High Alternative, Health Choice Basic and Basic Alternative, Health Choice High Deductible Health Plan, HDHP, and the TRICARE Supplement. The TRICARE Supplement is available only to those under age 65 with TRICARE coverage as a current or former military member. Information on this plan is not included in this presentation but is available in the guide and on the EGID website. For more information than what is included in this presentation, refer to the 2020 Employee Benefit Options Guide. HMO plans. To be eligible for an HMO, you must live or work within the zip code service area of the HMO. If you do not live or work in an HMO service area, you are not eligible for that HMO. Check the zip code lists in the 2020 Employee Benefit Options Guide at omes.ok.gov. In the menu under Services, select Employees Group Insurance Division to access the guide, which is posted under Current Employees. Be aware that zip code service areas can cross county lines. However, the HMO may not be available in both counties. Contact the HMO for more information on service areas. The HMO plans use a copay structure. Each copay amount is based on the type of services or supplies received through the HMO's network of physicians and facilities. When you enroll in an HMO plan, you and your covered dependents must select a primary care physician, also referred to as your PCP, from your plan's provider list. Your PCP is responsible for your medical care, including referrals to specialists and obtaining the required authorizations for medical procedures. Medical services that are not coordinated through your PCP are at your expense. However, some HMOs allow you to self-refer for specialist care or wellness exams as long as you remain within the HMO network. Please check with each HMO for details on referrals to specialists. Remember, you enroll with a plan, not a provider. The loss of your PCP from your provider network is not a qualifying event for you to change plans before the next annual option period. In the event your provider leaves your HMO's provider network, you must select another provider from your plan's network. Blue Links HMO. When using a network primary care physician, you have no office visit copay. If you see a specialist, the copay is $50. There is a $250 copay for an MRI, CT, PET, EEG, ECG, MPS, and similar. The copay for an inpatient hospital stay is $250 per day, up to $750 per admission. If you use an urgent care clinic or facility, your copay is $25. For each emergency room visit, the copay is $300. The copay is waived if you are admitted. Blue Links HMO pharmacy benefits. You can purchase up to a 30-day supply of medication per copay. The copays are preferred generic $0, non-preferred generic $10, preferred brand $40, non-preferred brand $80. Specialty medications are $100 for preferred and $200 for non-preferred. Mail order is available. Be aware that some medications have quantity limits. Community Care HMO. When using a network primary care physician, you have a $35 office visit copay. If you see a specialist, the copay is $50. There is a $200 copay for MRI, CT, MRA, and PET scans. The copay for an inpatient hospital stay is $350 per day, up to $1,750 per admission. Pre-authorization is required. If you use an urgent care clinic or facility, your copay is $50. For each emergency room visit, the copay is $200. The copay is waived if you are admitted. Community Care HMO pharmacy benefits. You can purchase up to a 30-day supply of a medication per copay at a retail pharmacy. The copays are Select Generic $0, Preferred Generic $15, Preferred Brand $40, Non-Preferred Brand or Generic $70, Specialty $160. If you choose to obtain a brand name drug when a generic is available, you pay the applicable copay or coinsurance for the brand name drug plus the difference in cost between the brand name drug and its generic equivalent. The difference in cost between the brand name drug and its generic equivalent will not count toward your annual out-of-pocket maximum. Mail order is available. Be aware that some medications have quantity limits. Global Health HMO. When using a network primary care physician, you have a $0 office visit copay. If you see a specialist, the copay is $50. There is a $10 copay for X-ray and lab. There is a $250 copay per scan at a preferred facility and a $750 copay per scan at a non-preferred facility for MRI, MRA, PET, CAT, and nuclear scans. The copay for an inpatient hospital stay is $300 per day, up to $900 per admission. If you use an urgent care clinic or facility, your copay is $25. For each emergency room visit, the copay is $350. The copay is waived if you are admitted. Global Health HMO Pharmacy Benefit. You can purchase medications at a retail or mail-order pharmacy. The copays for up to a 30-day supply are Tier 1 generic $10, preferred brand $65, and non-preferred brand $90. Specialty medications are $200 for preferred and $400 for non-preferred. Be aware that some medications have quantity limits. Health Choice High. The Health Choice High plan is designed for those who are tobacco-free. The plan provides the following benefits when you use a Health Choice Network provider. There is a $30 copay for primary care office visits and a $50 copay for specialist office visits. Services beyond an office visit, such as lab work, X-rays, surgical procedures, or hospital stays, first apply to the calendar year deductible of $750 for each covered individual. For a family of 3 or more, there is a combined calendar year deductible of $2,000. Once you reach the deductible, you pay 20% of allowable fees until you meet the out-of-pocket maximum. There is a $200 emergency room copay, which is waived if you are admitted. The network out-of-pocket maximum is $3,300 for individual or $8,400 for family. You are not responsible for amounts above the allowable fees when using a network provider. Health Choice High Alternative. The Health Choice High Alternative plan is designed for those who are not tobacco-free. It is identical to the Health Choice High plan, with the exception of the deductible and individual out-of-pocket maximum. The benefits that differ include the following. The calendar year deductible is $1,000 for each covered individual. For a family of 3 or more, there is a combined calendar year deductible of $2,750. The network out-of-pocket maximum is $3,550 for an individual. Health Choice Basic. The Health Choice Basic plan is designed for those who are tobacco-free. Office visit copays do not apply. The first $500 of covered expenses is paid by the plan. After the first $500 of coverage, individuals must meet a calendar year deductible of $1,000. For a family of 2 or more, there is a combined calendar year deductible of $1,500. Only allowed amounts for covered medical services count toward the deductible. Once you meet the calendar year deductible, you pay 50% of allowed amounts for covered medical services until you meet the calendar year out-of-pocket maximum. The out-of-pocket maximum is $4,000 for individual or $9,000 for family. Health Choice Basic Alternative. The Health Choice Basic Alternative plan is designed for those who are not tobacco-free. It is identical to the Health Choice Basic plan with the exception of the first dollar coverage and the deductible. The benefits that differ include the following. After the plan pays the first $250 of covered expenses, individuals must meet a calendar year deductible of $1,250. For a family of 2 or more, there is a combined calendar year deductible of $1,750. Health Choice High Deductible Health Plan. Health Choice HDHP is designed for use with a health savings account, referred to as an HSA. For individual coverage, there is a $1,750 combined medical pharmacy calendar year deductible you must meet before any benefits are paid by the plan. The individual deductible does not apply if 2 or more family members are covered. For family coverage, there is a combined medical and pharmacy family calendar year deductible of $3,500. The entire $3,500 deductible must be met before any benefits are paid by the plan. After you meet the entire deductible, a $30 office visit copay applies when using a network provider who is a general physician or practitioner. A $50 office visit copay applies for a specialist. For services in addition to an office visit, you pay 20% of all allowable fees until you reach the out-of-pocket maximum of $6,000 for an individual or $12,000 for a family. You are not responsible for amounts above the allowable fees when using a network provider. Only network charges count toward the calendar year out-of-pocket maximum. The individual out-of-pocket maximum does not apply if 2 or more family members are covered. To make enrollment in a health savings account easier and more convenient, Health Choice has contracted with American Fidelity Health Services Administration to provide an HSA, or you can enroll in one through the financial institution of your choice. Health Choice Select Program. The Select Program is available to all Health Choice plans. Features of the Select Program include 100% coverage for certain services and procedures provided on the same day when using select facilities. There are no out-of-pocket costs for members. However, HDHP members must meet their deductible before this applies. To learn what procedures are covered at 100%, visit the Select webpage at healthchoiceok.com. Health Choice Pharmacy Benefits. The High Alternative, Basic, and Basic Alternative plans have a $100 individual pharmacy deductible with a $300 maximum deductible for a family. HDHP members must meet their combined medical and pharmacy deductible before benefits are paid. The pharmacy copay structure is the same for all plans after the appropriate deductible is met. You're responsible for the entire cost of your medications until the deductible is met. When you purchase up to a 30-day supply at a network pharmacy after your deductible is met, you pay up to $10 for a generic medication, up to $45 for a preferred medication, and up to $75 for a non-preferred medication. For up to a 30-day supply of a specialty medication, the copay is $10 for generic, $100 for preferred, and $200 for non-preferred. Some medications have quantity and/or dosage limits, and some medications require prior authorization before they are covered. Health Choice Pharmacy Benefits. You can fill prescriptions at Health Choice Network pharmacies. Medications on the Health Choice Preventive Medication List are not subject to the pharmacy deductible or the HDHP medical pharmacy deductible. Copays do apply to these medications. You are responsible for the cost difference between a brand name and generic medication if you choose a brand name when a generic is available. To encourage members to quit tobacco, Health Choice covers certain prescription tobacco cessation medications for no copay. Visit healthchoiceconnect.com to search for network pharmacies and preferred drugs.